Governor Salary-Nwifuru of Ebonyi State has announced a new salary package of 500,000 naira for newly employed medical doctors working in primary healthcare facilities across the state. He made the announcement during the flag off of the Health Activation Initiative, which signals the start of the drug revolving fund and the distribution of medical equipment to general hospitals. The governor reveals that his administration has invested over 10 billion naira in upgrading health infrastructure, procuring medical equipment, and strengthening the healthcare workforce. To bridge the human resource gap in the sector, Nwifuru said the state government has recruited 195 healthcare professionals, including doctors, nurses, pharmacists, and laboratory scientists, who have been deployed to general hospitals to enhance service delivery. Well, I've had conversation with you and over the brain drain and the medical aspects, and paying doctors substantial amounts, catering for their welfare and all of that. And analysts like you have made statements over the incremental salary. This decision by Ebonyi State Governor to increase the salary up to 500,000, I'm sorry, and other infrastructural deficits that has been taken care of. I want to get your thoughts on this, please.
If you ask me, I will give an accolade to the governor, because at this same station we had a similar conversation like this one, where I actually was praying that God should touch the heart of governors of Nigeria, for them to know that health sector is a place we should put first, no matter what we are doing as people, as a people. So what I'm trying to say is that I'm giving the governor accolade. He has, according to what I heard that he has employed about 195 personnel. I mean, health officers. I think is a welcome, what they call it, say for me. And I also want to say a very big thank you to him for hard. I've heard to the plea of the people of Ebonyi State. Before this time, I have heard them complain, not just only on the national television, that their health sector is dying. And that if you talk about development, that development has been everywhere in Ebonyi State. But then, in the health area, that nothing has been done. And I told you something about the Japa syndrome last time, that the major reason why people are leaving the country is not just only because they want to leave, but because of the salary, what they call it, the salary level. You cannot be practicing in such field and you be paid a stipend of little amount. As a person, it will break you into pieces, like as if all of your effort is not being appreciated. So they feel that once they are there, they are being paid a wolf amount, and those amount helps them to either take care of themselves and other things around them. So I give it to N500. I think that's the name of that governor. I give it to him. He has done something that even the dead will want to give him accolade, in the sense that Ebonyi will walk again. When you say Ebonyi will walk again, the health of those who are around there will be quickened and will be restored. If another thing is this, if actually what they have professed is what is being put in place, politicians cannot be trusted. Quote me. They cannot be trusted. They might just come, either they have employed their relatives, maybe 10 or 20 of them, and all of a sudden you see them publishing that they've employed more than 2,000 personnel. And when you go there under your own research, you notice that they are not up to that number. And because they are not up to that number, maybe those who are related to them are people who will always want to come and attest that they were being employed, whether they are from the same family or something. But then, if truly he has employed people from Ebonyi State, I repeat, he has my 100% accolade that he has rekindled the mindset and mentality of the previous cry of the people that are from their own state, you know. So he is saying he has invested both in what is it called, even in drugs and other things, that they've gotten those accessories for them, and he has vowed to ensure that the health of Ebonyi people becomes something that he can always raise his arm and say he is proud and has restored the health of people of Ebonyi. If he has done that, believe you me, he has the vote of his people also, because he has given them the highest ultra.
No, what do you mean by he has the vote of his people?
Yes, why I say he has the vote of his people is because, you know, I have always said it here that
he's already the governor of
he has the vote. I'm not saying
in what aspect?
Maybe if he has interest to run for second.
You're not campaigning for
I'm
him
not,
here.
I'm not. Okay. I am not. I'm only saying that he has the vote of these people because he has given them what is being expected of him. You know, some persons will come as politicians and they will tell you they will do this, they will do that, they will do that. When the time comes, they tell you, you see them telling you, is it that your vote you want? Someone did it in Port Harcourt here, in River State. I don't want to mention the particular local government. A local government chairman said,
so, in essence, are you trying to say that he did this with the intention of getting votes from the
no,
people?
No,
or that's a necessity
of
something that has to be
yes,
done?
It is
because he's there to serve the people and
you see, I have told people that what the government owe the citizens is what we call social amenities, which you know, and health is the number one thing. If you ask me, even in the Bible, it is also enshrined there where God said, "He wishes us above all things that we prosper." But be what? In good health, even as our soul prospereth. It means that God knows that health is more important. Health without wealth, wealth without health, it's like someone being in hellfire, claiming that he's in heaven. That's just the truth. So what I'm trying to say is this. He has, on his own, made research and has seen that his people have been dying because the health sector was not refurbished. So he has come with the mindset that I want to rebuild the health sector and give life to my people. And you know, like I told you, he has started working on those social amenities. He has started giving it to them. The first priority, I heard him mention during his campaign, he talked about health, and he has played that role by giving them that accessories, and has employed doctors that will help him. You know, it is not just only in the city he did this. He sent out to the rural area also. So it means that he has taken health, what they call it, he has taken health to their door post. And with that, I know that's the reason why you heard me say he has the vote of his people. Not like he's doing it because he's campaigning. No, he has redeemed what he has promised. He has promised his people.
Okay, I wanted to ask a quick question on this aspect of health, because almost all state governors, all state governments would want to improve or refurbish their healthcare sectors, just like you've stated, as Nwifuru has taken this step. Is it that to get this done, most of these governors have to pay their healthcare personnel 500,000 naira to that extent, or it's something that it just has to be put into consideration? I'm just asking in this aspect that Nwifuru has taken this step. Is this something that every other governors have to take this step by paying this amount? And then I also wanted to ask, does the state have the capacity when it comes to revenue to actually keep this in check for the period of time that he wants to get this done?
Yes. Like you said, you see, if the state government if other state government will want to emulate Mr. Nwifuru and then begin to increase the salaries of the medical professionals.
Is Governor
now, so what I'm saying is that there are some states in Nigeria where they pay even higher. Lagos State, they pay them very, very, do I say handsomely? They pay them. I've met with some doctors who are my friends out there. They told us the amount they have been paid, you know, and those ones are not ready to japa or do anything. But you should know that this people's kind of job have to do with health. And when you mention health, there are persons with ailments that are heavy, that if you should come across, if you should come across them, you might be affected or infected, as you call it. Now, if you are being infected, your own health, what happens to you? The reason why they are paying them this is for them to also take good care of their own selves. And it's for them to also get encouraged to keep pursuing and ensuring that the hospitality of and welfare of the citizens are being followed and being taken care of. Again, yes, we have the revenue, if you ask me. I've told you before, some things that happens in the country is not about the revenue. If you ask me, do you know how much these people get as allocation? Do you know how much they get as security vote? Do you know how much they get from the revenue? Even the state that is as small as Bayelsa, I mean, and as small as Ekiti State, we look at them like nothing is happening there. Things are happening. Are you telling me that the whole amount that is being sent to the governors, that is what they use in paying all of the salary and nothing is remaining? Is that what you are trying to say? No. The ones that has a heart to take care of their cities, their subjects will do. The ones that does not have the heart to do so will not do. And again, most of them, you see them say, we have done that, we have done that, we have done this, we have done that. They have not done anything. You will just see them do camouflage. They will just come with few of those medical accessories and see them riding on some of the ambulances, showcasing some of those things. They are all arranged.
So in essence, this decision by the state governor, Ebonyi state governor, is it going to keep most of the doctors that have the intention of wanting to leave, or it's going to bring back some of them that already left? It will encourage some of them, even the Japa teams, those who are out there too, they're also crying now. They are crying. How are they crying? Some of them, the kind of job they do here and the ones they are doing there is not the same. Even in your own profession, you see them crying, we do this job 3 hours, 4 hours, 5 hours. But in the other area, we do it as a shift. I can work today, tomorrow I'm not coming to work, and all that. But they are crying in the sense that they complain of the taxes that is being paid. Do they pay that level of taxes in Nigeria? No. They are complaining that everything around them revolves on tax. With that move, most of them will want to come back. Okay.